Hello and welcome to Good Life, the health show with me, Pooja. Well, viewers, experts don't know if pregnant women are more likely to get coronavirus or COVID-19 than other people. But because of the changes women go through during a pregnancy, they may be more likely to get some infections. So, to discuss on this, we are being joined today by Dr. Ratul Dutta, gynecologist from Downtown Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Dr. Ratul Dutta, for joining to Good Life, the health show. And today, the topic which we have taken today, actually, it is the question which is surfacing in everybody's mind, and especially the women, because they want to know that should someone try to avoid pregnancy during this COVID-19 episode?
Pregnancy is a period. It's a period. It's an experience of one lady's in lifetime. So the pregnancy experiment should be a healthy one. It should be a pleasant one. Now the situation is a COVID situation. So whether we should plan for pregnancy or not, it's a $1,000,000 question. And many people say that one can plan for pregnancy, and some people say you should not plan. Now it's practically a personal choice whether you will plan for pregnancy or not. Because if someone gets pregnant during this time, there might be some problem may arise. It may be some situation problem may arise. So to avoid that situation, one may not plan pregnancy during that time. But if she becomes careful or entire family becomes careful, if they can prevent from getting COVID infection, then there is no problem in getting pregnancy during COVID time. So during COVID situation, planning for pregnancy is one's own personal choice.
Okay.
And if someone plans for pregnancy, she has to be careful so that she does not get infected by COVID.
Absolutely, doctor, because one has to be very careful because if a woman is pregnant, she has to visit hospital quite a number of times for checkups and all. So in that scenario, one has to be very careful, and that has been also taken care by their family members as well, isn't it?
Yes, it's very good. Very good.
All right. Now, doctor, what might be the problems like if someone gets pregnant and during this COVID-19 scenario, if a woman gets pregnant during this COVID-19 scenario, so what kind of problems she is going to face if she conceives?
See, the pregnancy is a situation where the immunity is altered. The patient's own immunity is changed during pregnancy.
Okay.
During this time, during pregnancy time, the pregnant patients are likely to develop, acquire some respiratory infections. And COVID is primarily a respiratory infection. So if someone gets COVID during pregnancy, that may be aggravated during pregnancy time. So that is the importance. In the first wave of COVID, there are different reports from different doctors and different institutions. They say that there is no much difference between pregnant ladies who are affected by COVID and those who are non-pregnant affected by COVID. But in the second wave of COVID, the scenario is little changed. So many doctors they are reporting that more seriousness is developing in the second wave.
All right,
doctor. Pregnant ladies are.
All right, doctor, we'll come to that seriousness of the second phase, but right now we have a caller, so let's take the call. Hello.
Okay.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় মই মংগলদৈ পৰা কৈ আছিলো একচুৱেলি মানে কি মোৰ ডিটেকশ্যন হয় 25 ডেজ হ'ল কিন্তু হৈছে কি মই মানে কনফিডেন্সত ভুগি আছো আৰু তিনি চাৰিদিন হৈছে আৰু মানে খোৱা লোৱাৰ বিষয়ে অলপ জানিব বিচাৰিছো মানে কেনেকুৱা মানে হেল্ল' ছাৰ
হয় কওকচোন
হেল্ল' ছাৰ হয় মোৰ মানে ডিটেকশ্যন হয় 25 ডেজ হ'ল
21st day of
হয় এতিয়া মানে মোৰ প্ৰব্লেমটো হৈছে কি মানে মোৰ কনষ্টিপেশ্যনত ভুগি আছো তিনি চাৰিদিন হৈছে
আপোনাৰ কি হ'ল 21 days হ'ল বুলি ক'লে
25 days হৈছে সিজাৰিন হোৱা
সিজাৰিন
25 days
হয় হয়
সিজাৰিন হ'ল 25 days হৈছে আচ্ছা এতিয়া কি
কনষ্টিপেশ্যন হৈছে আজি তিনি চাৰিদিন হৈছে
কনষ্টিপেশ্যনৰ প্ৰব্লেম আচ্ছা সিজাৰিন হৈছে 25 দিন আগতে আপোনাৰ কনষ্টিপেশ্যন হৈছে আপুনি ডায়েটটো সাপোজ এটা অলপ সফট ডায়েট আপুনি খায় আৰু ধৰক পানী অলপ বেছিকে খাব আৰু যদি খুব বেছিকে যদি কনষ্টিপেশ্যন আপুনি গাখীৰো খাব পাৰে বেছি যদি কনষ্টিপেশ্যন হয় তেতিয়াহ'লে ষ্টুল সফটনাৰ আপুনি ল'ব লাগিব আজি বেসিক্যালি আমি কোভিড রিলেটেড প্রেগনেন্সি এন্ড কোভিড রিলেটেড ডিসকাশন বিলাক কৰি আছো সেই ৰিলেটেড কিবা প্ৰশ্ন থাকিলে বেছি ভাল হয়
All right. Thank you so much for calling at this point in time. And our numbers are flashed on your television screens, viewers. So if you have any queries regarding the question and the topic which we are discussing at this point in time, please call up and ask a query. And I'm sure Doctor will be able to give you all the answer. All right, Doctor, we were talking about the risk of pregnant women during the first and the second phase. Now, you were talking about the second phase. Please proceed.
Yeah, many doctors from many institutions and many hospital data says that during a second phase of pregnancy, a second phase of COVID, the pregnancy complications are a little more serious. So the importance of taking safety measures and all maintaining COVID protocols very strictly has become very important. And getting pregnancy during COVID time, it added some problem. Like say if someone gets pregnant, she has to go to the doctor regularly, frequently they have to go. She has to go to the clinic, she has to go to laboratory to do certain tests.
Right.
So all these activities may expose her to getting infection, COVID infection. So they have to be very careful. So before planning pregnancy, I personally prefer if patient is young, then she can get her vaccinated first, then she can plan for pregnancy. See if there is no hurry. But if someone is little elderly, but someone is under infertility treatment, in that case, where time is very precious, in that case, they may go for pregnancy planning during COVID situation. But they have to take proper precaution. They have to be very alert. They have to be very alert that she doesn't get contract COVID during this situation.
All
I
right.
can give you an example. Yeah.
Right. Please continue.
One practical problem. Say, lady is has not got COVID, but entire other family has become COVID. I have got one experience. One of my patient whose the pregnant lady she was only not COVID positive, but husband, children, father-in-law, mother-in-law all became COVID positive. So it became a great problem for her. Though she was not affected by COVID, but she has to take care of all entire family members, those who have become COVID. So this is a practical scenario.
Okay.
So in that scenario, if we avoid, then it's always better. But if situation demands, if someone feels, then definitely she can go for having pregnancy. So in nutshell, whether we should plan for pregnancy during COVID situation or not, we have to analyze all these things and accordingly we have to take our personal decision.
Absolutely. This is also going to be a very challenging factor for the women because taking care of their family members during this COVID period and when they are infected with it. But at the same time, if the family members takes care of the woman who is already pregnant, she can be kept isolated somewhere else so that she can be safe and her baby can be safe. Isn't it, Doctor?
That's very correct.
Yeah. So on that note, what kind of suggestions you would like to give the family members if this kind of scenario erupts at this juncture?
The normal guidelines for all COVID patients is followed. The same guidelines has to be followed. Now, as we know, all the protocols we follow that distancing, using mask, sanitation, all those things we know. So those protocols has to be maintained strictly. And she has to be very careful. She should not unnecessarily go out of her house. If so, she should go only when she used to visit the doctors or when some tests are required. Nowadays, teleconsultation method also somebody can take. Nowadays, doctors, many consultation can be done by teleconsultation way.
Right.
So that way also she can take some consultation. Nowadays, many laboratories, they are doing home collection. So that way, samples can be taken, collection can be done at home also. So that way they can reduce their visit to the laboratory. They can reduce the visit to the chamber, and that way they can plan for pregnancy. They can go carry out their pregnancy.
Right, Doctor. So a lot of cases erupts and a lot of cases you get through to your whole day in this COVID situation. So at this point in time, have you ever met any of the patient who is on a critical situation? So what kind of suggestions do you give? All right, Doctor, we'll come to that question, but we have a caller. So let's take the call first and then we'll proceed with the conversation. Hello?
Hello.
Hello. Yeah, we can... আমি শুনি আছো আপোনাৰ
I
প্ৰশ্নটো
just
কৰিব
wanted to ask about menopause. Like during time of menopause, is there any chance of having high blood pressure? Is high blood pressure is a symptom of menopause?
High blood pressure is a symptom of menopause.
Yeah, is
No,
it?
it's not a symptom of menopause. No, it's not a symptom of menopause.
Okay, so what are the symptoms of menopause? I wanted to know that.
Okay, in menopause, many problems she may be facing. Some patients they don't feel any problem, and some patient may feel some problem like vasomotor symptom. Vasomotor symptom mainly hot flush. So
Okay.
hot flushes are common symptom faced during menopause, and sometimes urinary tract infection kind of situation they face. They face that frequency of micturition, burning of micturition, all those problems arises. So these are common vasomotor symptoms of menopause, and that can be taken care of by proper medication. And one thing, whenever some symptom arises, then they should go for a checkup. They should consult a gynecologist. A thorough checkup should be done. Especially the pap smear should be done. Gynecology malignancies, all those things should be taken care of. That should be examined properly.
Okay.
And those are some regular checkups should be done. And regarding symptoms, as you said, that whether pressure increases during menopause, no, pressure is not related to menopause. Diabetes is not related to menopause. But yes, with menopause, a lady who is appearing menopause, she should have a thorough cardiac checkup. She should have a thorough general checkup, thorough gynecological checkup.
All right, doctor, we'll have a more conversation at this point in time, but right now we'll have to slip into a short break. So viewers will slip into a short break, but do come back soon because we have lots more on the other side. Welcome back. You are still watching Good Life, the Health Show with me, Pooja, and we are having a fruitful discussion with Dr. Ratul Dutta from a downtown hospital. So, doctor, coming back to the conversation we were having, that is it a risk, like if a woman is detected pregnant and she is pregnant and also COVID-19 is being detected in that woman? So, what kind of suggestions do you give? What kind of precautions that person has to take?
As I have already told you, that during that time there is a immune changed. It's a situation where immunity changed. So she is more likely to develop some infections, especially respiratory tract infection, and COVID is one kind of a respiratory infection. So one has to follow the protocols, that is the guidelines, that is mandatory for this all people. Similar protocols should be adopted by those pregnant ladies also. Maintaining a distance, the sanitation, wearing mask, avoiding crowd,
Okay.
having good immunity boosting, your diet, exercise. Also, the positivity in mind. That is also very important. One has to reduce her mental stress and strain out of COVID. We have seen many people that are having some psychological trauma during this situation, during the COVID situation. So one has to keep their mentality positive. The thinking should be positive because they also affect the pregnancy. So one should remain in good positive mood, and they should have proper diet, proper nutritional diet, then proper sanitation, all those protocols he has to follow. So that way they have to make their lifestyle favorable for good pregnancy, carrying out good pregnancy.
Absolutely. The lifestyle has to be changed according to the favorable condition, because at this juncture, one has to lead a different kind of lifestyle regarding the lifestyle which a normal pregnant woman leads, isn't it? Now, if we talk about the delivery process, doctor, of a pregnant woman, one who is detected with COVID-19, will it be normal or cesarean, or what suggestion do you give?
Okay, say one lady is pregnant now, her time is for delivery.
Okay.
So in that scenario, the delivery mode of delivery is not altered by COVID. Say one patient, she may have normal delivery also. She may, if required, she may undergo cesarean also. So mode of delivery is not determined by COVID.
Okay.
It's not like that she is having COVID, so she will need cesarean section. It's not like that. she may have normal delivery also. But that COVID pregnant lady should be delivered in a COVID hospital, where a proper COVID care is given by the pulmonologist or critical care specialist or the people who deals COVID patient, because it needs a different setup, different altogether all hospital setup is required for a COVID patient. So those specially designed COVID hospital, they should have their delivery done in their COVID hospitals.
All
And
right.
maintaining all for the standard protocols, standard treatment for COVID patients, all those things has to be maintained.
Right.
But the mode of delivery
Yes.
does not determine by COVID. She may have normal delivery like other people. She may have cesarean section like other people.
Okay, whichever situation is preferable for her. Okay, doctor, now after the delivery, what are the safety norms taken for the baby? Can the mother breastfeed the baby or not? There are several questions which arise after the delivery. So on that note, what do you have to say?
It's a very common question asked by people whether
Okay.
they can have breastfeeding or not. They can have breastfeeding. There is no problem at all. They should have breastfeeding. Baby should be given breastfeeding. And one important point regarding breastfeeding, if mother is getting vaccinated for COVID, then this antibody produced in the mother's body is passed to the baby through the milk. So baby will get the immunity. So breastfeeding is very important. So rather, breastfeeding will help the baby to get protected. But one thing it must be understood that while feeding the baby by the pregnant mother, she has to be careful so that the contact the baby should not get infection from the mother. So mother has to sanitize her hands properly. She has to wear mask.
Okay.
She has to clean her breast properly. They should have feeding. Then baby should be again separated. The baby should be isolated from the COVID mother. But during breastfeeding, she can give breastfeeding with all precautions, all taking care, all to avoid to prevent the baby from getting infected. So all precautions to be taken and baby will be breastfed and baby will be isolated again. So breastfeeding is contraindicated. Breastfeeding should be continued and it should be continued and proper care should be taken by the mother, by the family person so that during your breastfeeding, baby doesn't affect by the mother, by the COVID patient.
All right, doctor, we have a caller at this point in time. Let's take the call. Hello.
হেল্ল' মোৰ বেবী বয় এটা আছে তাৰ বয়স 1 বছৰ 4 মাহ মই জানিব বিচাৰিছিলো যে এতিয়া ব্ৰেষ্ট ফিডিংটো ষ্টপ কৰিব পাৰিম নেকি
বেবীটোৰ বয়স 1 বছৰ
4 মাহ
4 মাহ আপুনি ব্ৰেষ্ট ফিডিং ষ্টপ কৰিব নালাগে আজিকালি এটা কথা কোৱা যায় যেনে তাৰপিছত ব্ৰেষ্ট ফিডিং ইজ or her birth right গতিকে you should not stop her or him getting breastfeed from you actually some বা 8 মাহৰ পাছত when this she starts her food normal food যেটা তাই তেওঁ নিজৰ খোৱা বেবিটোক খোৱা আৰম্ভ কৰে তেতিয়া ব্ৰেষ্টফিডৰ ইমান প্ৰয়োজন নহয় ব্ৰেষ্টফিডৰ ইমান প্ৰয়োজন নাথাকে কিন্তু এইটো এটা ইট কেৰিজ এ ইমোশনাল বন্ডিং বিটুইন মাদাৰ এণ্ড চাইল্ড যেটো স্পেশালিষ্ট সকলে চাইল্ড স্পেশালিষ্ট সকলে কয় it should not be stopped it should be continued breastfeeding should be continued
All right.
প্রয়োজন তার ফিজিক্যাল প্রয়োজন নাই there is no physical but it builds up a emotional binding between mother and child.
All right. Now, doctor, you were earlier saying that it's always better that if a young girl is planning her pregnancy, so she should get vaccinated first and then plan up. So on that note, what do you have to say?
I personally feel if the patient is young, she is a young girl, young lady, then she has got plenty of time to have pregnancy. So why she should take an unnecessary risk? Where there is a possibility, you never know, you may contract COVID during pregnancy also.
Okay.
So since you can spare time, you have got time. So better you get vaccinated first. Take the vaccine properly, take some good food, good diet, take folic acid, prepare yourself for a good pregnancy, then you plan for pregnancy. Then even if you get COVID pregnancy, you are safe. Your antibody is there to fight with the COVID. So your severity of COVID during pregnancy will be less. So that's why I always, it's my personal advice. Those who can afford to postpone, they can have pregnancy accident to her vaccination first, then they should plan for pregnancy.
So this is the
And those who
suggestion.
are already, if someone has already getting pregnant, nothing to worry. Nothing to worry. You continue pregnancy, maintain all COVID protocols, maintain all the safety measures, and you continue pregnancy. And also, you can take action, you can have vaccination during pregnancy also. Now, Government of India has allowed vaccination during pregnancy. So
All
you
right.
can take vaccine during pregnancy also.
All right. So
Nothing
is
to worry.
vaccination allowed during pregnancy, doctor?
Pardon?
Is vaccination allowed during pregnancy? What you are
Yes,
saying?
yes.
Okay.
Yes. During pregnancy, vaccination is allowed.
All right. So after the vaccination, like if a person takes any vaccination or if takes a COVID-19 vaccine, a lot of side effects has been seen. So in that juncture, normal people can take some of kind of medicines. But what about the pregnant women? She will have to have that limitations of taking those medicines like a paracetamol or something like that. So on that note, what do you suggest to them?
If some pregnant lady gets infection by COVID during pregnancy time, then she has to take all medication which are necessary to treat COVID.
Okay.
That will be as per guideline of COVID, treating a COVID patient. Now, some drugs, normally we try to avoid majority of the drugs during first 3 months of pregnancy, because during that time amenorrhosis happens, baby is growing. So, in second trimester onwards, many of the drugs are safe. But while giving medicine, that point has to be taken care of.
Okay.
Which medicine is safe during pregnancy, and those specialized persons who treat COVID patients, they know which medicine to be given a pregnant lady, which to be avoided, which are not to be avoided. And accordingly, as per guideline, as per protocol, treating a pregnant lady, a pregnant COVID patient, patients are being treated.
All right, all right. Thank you so much, Doctor, for joining us at this point in time and sharing those wonderful words. I'm sure the viewers who have watched our show must be benefited with the answers just Doctor gave. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing more on other health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.